Few days ago, I posed a question to my graduate school group on Facebook. What is the most challenging class in nursing school? An overwhelming 99% of the responses pointed to pharmacology. This is no surprise considering that a nurse's role involves administering medications, monitoring patient outcomes, and educating patients and their families about medications. Mastering pharmacology is essential for any aspiring nurse. In fact, pharmacology holds a significant place in the NCLEX RN test plan, with pharmacological and parenteral therapies accounting for 16% of the exam. This highlights the importance of thoroughly understanding pharmacological concepts outlined in the nursing curriculum. To support this learning process, Let's Simplify Pharmacology is a series of videos designed to make these complex concepts easier to grasp. In this video, we will focus on pharmacokinetics, breaking down its phases and explaining them in a clear and concise way. Let's dive in. Hello, I'm Nurse Freddy, a nurse educator at Pharma Nursing. In this video, I'll guide you through mastering pharmacological concepts. Let's learn together and make pharmacology simpler and more manageable. Once you find the definition of pharmacokinetics hard to remember, try breaking it down into two parts, pharma and kinetics. Pharma refers to medication, and kinetics relates to movement. So, without memorizing the exact wording, you can understand that pharmacokinetics involves movement of medication through the body. To put it simply, pharmacokinetics is the process of how medication travels through and interacts with the body. It's important to understand that as medication moves through the body, it undergoes a series of biochemical processes. These processes include absorption, distribution, metabolism, and excretion, or simply ADME, add me. These four processes represent the key phases of pharmacokinetics. Keep ADME or ADME in mind as we explore each phase in detail. Let's start by considering absorption, a critical phase of pharmacokinetics that occurs after medication is administered. Absorption refers to the movement of medication from the site of administration into the bloodstream. For example, when insulin is administered, it travels from the subcutaneous tissue into the bloodstream. However, it's important to note that the pattern of absorption differs depending on the route of administration. Medications given through parenteral route, such as injections, are absorbed differently than those taken via the oral route. In our next video, I will explain the various routes of administration in detail to help you gain a deeper understanding of how absorption works. Once the medication enters the bloodstream through absorption, the next phase of pharmacokinetics begins, distribution. In this phase, the medication is transported to the target cells. It moves into interstitial fluids, the fluids that fill the spaces between cells and blood vessels, and intracellular fluids, the fluids inside the cells. Bodily fluids play a key role in assisting the distribution process, ensuring the medication reaches the areas where it's needed most. The next phase of pharmacokinetics is metabolism, a crucial process that converts medication into an inactive or less active form, making it easier for the body to excrete. Metabolism enhances medication's therapeutic effects while also facilitating its elimination. This process reduces the risk of toxicity as the medication is broken down into a safer inactive form. However, It is important to note that some metabolites remain active. These are referred to as prodrugs. The liver is the primary organ responsible for metabolizing medication. With this in mind, educating patients and their families is essential, especially about the risk of overusing over the counter drugs like acetaminophen or Tylenol, which can be hepatotoxic and lead to liver damage. The final phase of pharmacokinetics is elimination, where medications are removed from the body, primarily through the kidneys. Proper kidney function is essential for this process. As nurses, it is critical to monitor BUN, which is the blood urea nitrogen, and creatinine levels, which are key indicators of kidney function. Elevated levels may signal kidney damage. In patients with impaired kidney function, medications stay in the body longer, increasing both the duration and strength of their therapeutic effects. This can lead to medication toxicity. As healthcare professionals, it is vital to stay vigilant and perform your due diligence when monitoring patients, especially those with renal impairment, to ensure safe and effective care. Thank you for joining me in today's episode. We explored pharmacokinetics, breaking down its phases and explaining them in a simple and clear way. Remember, it is okay if it feels challenging at first. As Albert Einstein once said, a person who never made a mistake never tried anything new. Keep going. You've got this. Don't forget to subscribe, like, share, and comment to share your thoughts and questions. I'll see you in the next video. Thank you and take care.